If you treat facial spider veins by electrocoagulation, you might be making one or all of these mistakes. I'm talking about common mistakes that can leave your patients scarred. My shortwave diathermy technique can treat 98% of facial spider veins safely and effectively, but only if you follow my 5 essential rules. In the next few minutes, I'm going to give you my proprietary checklist, starting with the 7-day skin secret. And make sure you stay until the very end, because my final tip involves a simple, chilled household item that practitioners almost always forget, and it's the single best way to ensure zero post-procedure blistering. Let's get started. My first rule starts a full week before the treatment. It's pre-procedure skin moisturisation. I advise my patients to use a high-quality moisturising cream for 7 days straight. Why? Well, this is your conduction catalyst. Well-moisturised skin allows for better electrical current conduction. Better conduction means you can use a lower current, which drastically reduces the risk of thermal injury and skin damage. It's your foundation for safety and efficacy. Rule number 2. This is about setting expectations. You must implement a strategy of careful consent. That means detailing the post-procedure appearance and healing process in detail. Tell your patient the treated area will be red and swell slightly. This resolves within 24 hours. More importantly, inform them they may develop small temporary scabs that look like bramble scratches, and these heal over the next 7 days. If they know exactly what to expect, they won't panic. And remember, do not consult and treat on the same day. The next rule is about insulation. For the treatment itself, you must be using the insulated safety shield technique, which simply means use insulated needles. When you apply heat to a tiny vessel, you must protect the surrounding skin. The insulated shaft prevents the current from damaging the skin surface, ensuring the heat is delivered only through the exposed needle tip directly to the vein. This selective targeting is non-negotiable for minimizing complications, especially for those people with darker skin types. Next, the recoagulation rule. This is the golden rule to avoid scarring. Don't overtreat. It's the #1 error I see. You must never coagulate the same vein twice in a single session. It's always better to undertreat initially and expect to do a touch-up session. And that touch-up session? It must be separated by no less than 6 weeks from the first treatment. This pause allows you to accurately assess the full result and to completely minimize the risk of over-coagulating a healing vessel. And finally, the tip I promised you, the ultimate secret weapon for patient comfort and safety, the instant post-procedure freeze. Immediately after treatment, apply an ice pack for a couple of minutes. Remove it briefly and reapply. And then apply a liberal amount of aloe vera gel that you have kept cold in the fridge. The combination of the immediate freeze followed by the cold gel application is critical. Along with the insulated needles, this step ensures complications like blistering remain incredibly rare. And one extra bonus tip: give your patient a tube of aloe vera to take away. Ask them to keep it in the fridge and to apply it 3 or 4 times a day. It not only soothes and moisturizes the area, it keeps it cool and it promotes the healing process. Now, if you've been hesitant to use shortwave diathermy because you fear complications, pigment changes or scarring, I get it. These 5 tips I've given you virtually eliminate those risks. Watching this video is one thing, but gaining the confidence to safely charge a premium for this highly effective treatment is another. I've taken my nearly 20 years of successful experience and distilled it into a comprehensive course, an online course and a hands-on course. This isn't just theory, it's the skill transfer you need to confidently use the Epil 100 diathermy machine and add a powerful, profitable treatment to your practice. You can take the online course or the practical course, whichever suits you best. Stop leaving money on the table. Click the links in the description below now to find out more about my shortwave diathermy courses and take the next step in mastering facial vein treatment in your aesthetic practice. Thank you for watching this video. If you found it useful, please give it a thumbs up. It really does help get the message out there about electrocoagulation for facial spider veins. And don't forget to subscribe. That way you won't miss my next video. Thank you for watching.